Hi, Dr. Justin Foster from Foster Chiropractor, the Tillmans Corner. Today I want to just take a few minutes and kind of tell you the basics of chiropractic care. You know, many people are coming to the chiropractor today and they see the benefits, but they really don't know just what we do for treatment, how we treat, or why we treat. So that's what I want to explain to you. And I'm going to show you the basics of the spine because you know chiropractors, we are spinal doctors, we're really nervous system doctors because we are concentrating on the nervous system and making sure there's no interference with it. So we're going to take a look at the anatomy of the spine. When you look at the spine, you can see there are some curves in the spine. Those curves are very important because they act like springs. And in life you get bounced or you jump or whatever. They help you so the body don't take all the force. The springs take out some of the force. Okay? When you look and see the spine is made up of 24 vertebrae. These hard bones, they are to protect the spinal cord, which runs in the side in the spinal column. You have 23 discs. These discs act like shock absorbers to take some more force out of the body. Okay, and then you have 48 facet joints in here, and that's the joints of each one of the vertebrae that join one to the other. Okay, and then you have 31 sets of nerves. That's the communication. That's how the body heals itself. When God created the human body, He made it so it would be a self-regulating, self-healing mechanism. It does that through the brain and the nervous system, the communication system of the body. If there's no interference with this and everything is working in harmony, the body can heal and regulate itself. But we live life, and what actually happens? We have stress, we have trauma, we have motor vehicle accidents, we have job injuries, work injuries, sports injuries. All those things cause sprains and strains to the spine or to the ligaments or the muscles that hold the spine intact. Okay? If everything is working correctly, it's in harmony. But if not, let's say you get what we call a misalignment. You get a sprain of this joint right here, okay? The vertebrae is going to go out of alignment. It's going to cause pressure on the joint, pressure on the disc, pressure on the nerve. Now, if it stays there long enough, you can get arthritis within the joints. You can get degenerative discs. Okay, and also if it stays there, the disc deteriorates enough, it's going to bring the two bones closer together, and when it does that, you can get a pinched nerve. Okay, so as a chiropractor, we want to show you how to fix this problem. And what we do is we look at the spine. Okay, we do a consultation with the patient to kind of find out what their symptoms are. Then we do a spinal examination to help pinpoint right where the pain is coming from. And then we take an x-ray of the spine to show you the x-rays and kind of see to help us pinpoint what degree is going on of damage within the spine. And from there, we want to fix the spine. How do we fix it? Well, we do what we call chiropractic manipulations. What it is actually taking a misaligned vertebrae and doing an adjustment, a light gentle movement to put the bone back into place. Okay? That is called an adjustment. That's where everybody jokes about the snap, crackle, pop, where it's really a chiropractic adjustment. And by doing that, we relieve the pressure off the disc, the pressure off the joint, and also off the nerve. And by doing that, we realign the spine, we restore proper mobility to the spine, and we relieve the stiffness and the pain. Now, what always amazes me, when people have these backaches and stiffness and they don't really know what's going on, they turn toward the medicine cabinet. They think that they're going to fix this by taking some type of pill or medicine. There's never been a pill that will put a vertebrae back into alignment. You have to have a chiropractic adjustment. So, if any of you have any stiffness or backaches, or even if you don't, you should have a spinal exam to make sure everything is working in harmony, okay? If not, you could get the exam and we could show you exactly what's going on and then determine a treatment program that would be good for you to get your spine working the best it's going to work, okay? So what we always say here in Tillmans Corner, if your spine is in a bind, we're easy to find, we're right off a range line. Thank you very much.